Session 3 and 4 taught by Dr. Reams and Black in 1977. This is tape 20 side B.
Very close. And if they are in close, all right, here you have it. Here is very wide, and they've got a nose down in here someplace. And you do find them here with them in here very close. Oh, I didn't get very good there. All right, they got to come in closer. All right, I'm not very much of an artist here. I should have my wife doing this. You be quiet. All right, if we put this one out a little ways, that'll help, won't it? All right, here we have them out there. Now, we have actually measured someone. The first nose, she says, has to come down a little longer. That's a nosy person. We have actually measured someone that you could take this distance of this eye and you could not put it between the eyes. And we have one that you could take this distance of the eye and you could put 3 or 4 eyes in between. One we put more than 3. And some will have very small openings and some will have big openings. So you could put more of them in there. So when you find them wide apart, they don't let things bother them so much. When they're very close together, they let everything bother them. Everything everybody does bothers them. So they're burning up their vitamin B and their silicon very rapidly. So when you have someone like this and you test them, you know that you're going to have to use much more vitamin B and silicon to get that person balanced out, and this is their genetic inheritance, and they will be that way, and they have to get dominion of it. But they will let things bother them that other people won't even bother about. And the other one is that they're so concerned about what other people think when the ears are set way back and there's a lot of the face in front. With these modern hairdos, you can't always tell anything by that, however. We use azomite for silicon. We use oat straw tea for silicon. We use rice bran syrup for silicon and vitamin B. It's an excellent source of both, one of the highest. So we use those for it. Vitamin B, yes. No. Rice bran syrup is a source of silicon and a source of vitamin B. All right? All right, now what? Back. If there is a spinal problem, it will follow like a line down the spine, or it will be right in the area where the spine is drawn in there. However, there can be back problems that will be out further than that, and we are doing a little research. There's never been any research work done to my knowledge in the iris and working with the ribs. I believe I'm the only one that has ever done anything with it, and this came on to me by accident with a personal problem, and we have been working with it now for a few years. And we are taking pictures now to show what we are finding, because we have been able to see it, correct the problem, but we don't have a permanent record, and now we'll be taking it. But I believe that when we find the problems out in here and out in this area, we are dealing more with the rib problem as it ties in with the spine, because these ribs are coming out here, you see. And I believe that out in here we're dealing more with the rib problem, and when it's a spinal problem, it will show up here, and oftentimes when a large area of the spine is involved, there'll be a white streak, and sometimes it'll make a line curve just about like that. Sometimes it'll only be a short area, and sometimes it'll show an inflammation wide like this, indicating the spine and going out into the hip area, going out further. Does that answer the question for you? Now, this isn't in the book, and I have never been told this. This is just what it seems from my own work and my own experience that this is what is happening. But we do find sometimes that the area will show out here more further away from what the line shows right there. All right. A problem, I don't pay too much attention to it unless I have someone that has a specific problem, and that is that your teeth are going to be located in the jaw area. And it's very difficult with as many people with drugstore teeth to tell what they're like in the wastebasket. But you can tell the condition of the gums and the condition of the jaw. And many times people will have abscesses or something like that. And we can locate it. And sources of infection sometimes you can find. And they don't know whether it's a tooth or not. You know, it used to be years ago that anybody that had rheumatism, why they said, well, you have a source of infection someplace in your body. Go have your teeth out and we'll check that. And they go jerk out all the teeth, and that wasn't it, so we try something else. But there was nothing wrong with the teeth, but you got them all out because you might have a source of infection that's creating a low ebb infection or a low temperature throughout the body. And my father was working at the railroad, and they had a doctor that was a company doctor, and every man that came in there, the first thing he told them to do was go have their teeth out if they had any kind of a pain. So this one came in, he told him to go have his teeth out, and he said, "All right, Doc, what's next?" And he put them in his pocket. He hadn't even checked him, but this was one of those things that was just with him. Anybody that came in, if they had a pain, why, you got an infection, go get your teeth out, and we'll start from there. Well, I find this a great deal, and I cannot necessarily tell if they've had their teeth out. I don't attempt to do that. But if they do have an infection or an irritation in the area or something, and they're talking about a root canal, sometimes you can tell definitely that that isn't what the problem is. We usually suggest holding myvitamineral or a colloidal sulfur. There is a colloidal sulfur on the market that we have found that is very, very effective. And I had one woman whose teeth were so loose they were falling out, the pus was running out of them. They were going to have all of her teeth out, or not out, I'm sorry. They were going to have to cut back away the gum and go up in and scrape and cut the gums away and all that. And so she used a little bit of colloidal sulfur. And I believe she used colasol. No, she didn't use colasol. She used sulfonol. No, it was in the health food stores. I don't know that it's available now. They have and haven't been available. But we have colasol some people are using. There's different ones. And we've had them use myvitamineral and just put it in the mouth and hold it. And all of them taste horrible. I mean, they taste nasty, but when somebody's facing having their gums all cut up and all that, they figure that it's worth it, and it seems to do the job. So those are some of the things that we have found when we find that area involved. Now, is there any other? I can't find a disease. I can't find necessarily what it is. You see, you got your tick, you got your paralysis, you got different things, and you can run it down through, and you can see if there's a nerve impingement or nerve inflammation. But I can't say that this is tic douloureux. I can't tell whether it is or not. Again, with a stroke, sometimes I've been able to detect stroke, and sometimes I can't. Sometimes I just have to have them tell me that they've had a stroke. I can tell that there's been a problem, but to say that's a stroke, I can't tell whether that's a stroke or an obstruction or a numbness or something else. I have people that have a rib. They have ribs jammed together. These two fingers are numb. If those two fingers are numb, I know where it is and I can free it up. Or these two fingers are numb. And some of them it goes up into the head and sometimes it goes down the arm. And oftentimes this is from a problem clear back here in their ribs or in the spine. And I think many chiropractors have had that situation where they make an adjustment and no longer do the hands go numb or no longer do they have the numb skull. I mean the numbness in the head. So there's different problems, but I can tell that there's a problem there, but I can't say, look, you've got a numb spot right here. I can tell they've got a problem, but I can't tell exactly what it is. I had a woman come in to me on the left side right here. She had a pain, a horrible pain. She just blinked her eyes and she couldn't hardly stand. She couldn't stand the light or anything. I had to even turn the room lights off, pull down the shades and darken the room. Part of the time she'd have her head wrapped up in a towel. And she had been in the hospital and they had operated, and she had an incision about 4 inches long right down in this area of the lumbars. And they had severed some nerves, and they told her that that would stop that pain. When she came out of anesthesia, she still had it. So they came up here, and in the area of the cervicals, right in here, she had another scar, 2 inches long. And they had gone in there and severed some nerves, and they still missed it. And they were starting to sedate her for another operation. They came in and gave her the first hypo or something. Her mother came and she begged for her to stop the operation, so they stopped it. And they wouldn't let them operate again. And she came to me, and I told her I wouldn't touch her. I mean, I didn't know what happened. Her mother brought her to me, and so finally I read her eyes, but I wouldn't touch her because I couldn't take that chance. And after a time, and her husband was in the hospital having throat cancer operation, and she was trying to hold down a job, if you can imagine, with earphones on there and answering service, plugging in telephones and answering service. She says, sometimes people talk to me and I can't even hear them. I don't even know what they're saying. It's hurting so bad. And I don't know whether I've answered their question right or whether I've been rude to them or not. It's so horrible. And then it'll fade away and then it just keeps coming back. And so finally her ribs were giving her so much trouble that I told her, I said, well, I'll put your ribs in place, but I won't touch the spine. And as I was working on the left side about halfway up, I'll have to show this on the right side because it's on the right. I got about halfway up, right about there, and the ribs were jammed together so much that it actually made a sound as they separated. Her mother looked over there, she grabbed her head, and the pain was gone. It's never come back, and that was 6 or 7 years ago. It's never come back. Now, I don't know what nerves they severed. I don't know what they went to, but they didn't go to the pain in the head, and the problem was released right down here. So this is what we sometimes find. So I can't say exactly what something is. Does that answer the question for you? All right. Any more questions? No more questions. All right. Yes? For hiccups. You've got a problem with spasm of the diaphragm there. Pardon? With the eye, I cannot look in the eye and tell if a person has hiccups or not. I can look in the eye, and while I'm looking in the eye, they hiccup, and I know it's hiccups. But you will find an inflammation of the diaphragm if it's been over a long period of time. And incidentally, some of you may have heard of that girl that was in Arizona that they had all over the United States. They finally got out to Arizona. All kinds of doctors, all kinds of therapists. They tried all kinds of things. She'd been hiccuping for, what, so many months? I forget what it was. Anyway, the poor girl was to total exhaustion from it. But you will find that there will be an irritation of the diaphragm there if it goes on for a long enough period of time. But it's a temporary thing, and I haven't particularly gotten concerned with it. All right. Is not right in the center, or the pupil is deformed a little bit, or the whole iris is. I've seen them where they were. I saw one that was almost egg-shaped, and the person didn't seem to have any particular problems that were any more than any normal child or any other problem. And apparently I think it was a hereditary problem, but I don't know about that. I just have to say I don't know. I did not connect it, or was not able to connect it with any specific thing. I don't know. I belong to the World Iridology Fellowship Organization. I have some slides here if somebody would like to look at them that are sent in from all over the world, where there have been case histories where they've run something down on one thing. And this is one of the volumes that I have of these. And if you don't take anything out of it, any of you would like to look through it, you're welcome to look through it. But please don't take anything out. Some of them are loose pages in there. But they take pictures and then give a write-up on some of those pictures. And some pictures here, with the pictures, do not be misled with the idea that the pictures take the place of looking at an eye, because these pictures, most of these pictures are taken, and it's true with all of these in this thing, they're taken with all kinds of different cameras, and some of them use a side lighting, and some are using a front lighting, and some they're catching the eye looking straight on, and some of them they turn their eye just a little bit, so that isn't an accurate thing with a picture. But when you're looking at the eye, you have an opportunity to tell it. All right, what do you see with this eye that stands out here? You've been able to pick out some things. What do we got? A sodium ring. All right. Which eye are we got here? What number are we on? 4. And we find it, and I've had a lot of fun in asking people when I find a lot of these, or when I find big ones. I say, do you trace your genealogy back into the area of France, or in the Alsace-Lorraine area, or through Belgium, along through there? And 99 times out of 100, they'll say yes. Now, once in a while, they'll get over into Yugoslavia, or they'll be up into Scandinavian, but it's 99 times out of 100, they trace one of their lines back into there. The theory goes something like this, that in that area they had a lot of venereal disease years ago, and there were some of these remedies, that were used, like, the old sulfur molasses treatment for thinning the blood in the spring. And with this sulfur molasses, you will always find it, if they have had that when they go on a cleanse, they're going to get a skin rash. They're going to get a skin rash. You can expect it. And so when you find these sulfur deposits, a lot of these sulfur deposits, you know that when they go on that deal, they're going to get that skin rash. Remember, John talked about some of these things where they just itch all over and it just drives them nuts. Well, they get this itching or skin rash and so forth. Well, it's believed that they used something to suppress that drove that into the area, or affected the genes, and it's passed down. It's a hereditary thing, and you'll find them many times. And this is the which eye do we decide this was in? This is the left eye. We're getting down there. No, the spleen. Yeah, that would include part of the spleen. We're getting a spleen right down along in here. You have to. It's difficult with pictures to be real accurate, because it looks like this eye is turned maybe just not on the straight axis. If you come straight across here, it looks to me like the eye wasn't right straight. We now have a camera where we can get the eye straight and hold it straight. I have a camera like that now. If any of you would like to see it, I have it in my room, and I'd be glad to show it to you. But it is the latest development. It's only been available for a few months. We haven't had that. And so if somebody just cocks their head just the slightest amount or turns their eye a little bit, why, it wouldn't be straight across. And so I would say that this is possibly a little bit lower. It could even be right into the, it could be into the spleen area there. Generally speaking, I'd look for the spleen just a little bit above that, but that may be twisted over there. All right? What's the stomach condition here? All right, we haven't even to show. I'm glad you brought that out. I'm trying to pick out certain things. I may overlook some. So here, you see, this is the outer ring. Here is the sodium ring, but this is a little different. This is where it just kind of looks like the sclera. It just kind of fades on in, and there's no definite line there. It's very difficult to see it, at least at this angle. All right. All right. Yes. Thank you for bringing that up. Maybe you can see it there. I'm not sure whether you can see it. Can you see where these blood vessels seem to come on in and then turn back? They come on in. Here they're coming in. They're only orange in here. Here they come right up to it. Here are some that come down in. We have seen some in this, even this far. You notice where this comes in. Comes right on into the iris, you see. Right. Remember John said when you have a lot of this right around here, you look to the what? Look to the stomach area. Look to the stomach. Here it is, and this is all the way around here that you see the inflammation. Except, well, there's some up here too, just a little bit, but not too much up there. But you see it all around here.
Is that a nerve ring that you have in the iris? Just inside of the outer
Oh, this?
Yeah.
No, that is not a nerve ring. No, that is not a nerve ring. This is a person with a very inflamed nervous system, and there is drug affecting the nerves. Now, you don't know whether that is you don't know whether that drug has been administered by a doctor or a hippie. All right, here's a nice little case here. Am I too much in the way here? When I get up here too much, I can't see. The screen kind of blocks it out. All of these are normal. The normal person has diabetes, isn't it? Now, or the average person has diabetes. Nobody knows what normal is, but these are certainly not the way they should be. If we were to have these, all of these lines would be smooth. They would all be a nice light blue. And they would all be very smooth right out here. It'd be beautiful. And the autonomic nerve wreath would just be visible. That's all.
Before, when we had the blue skin problem, so let's say this was normal, shouldn't it be nice?
Well, you see, when you start looking at an eye, some people have light blue eyes, and some people have dark blue eyes, and some people have light brown eyes, and some people have dark brown eyes. And so when we're looking at that, we're looking at what the condition should be. And if you have a nice color and then you have a real dark area around here, that is a scurfrium for that person. A person with a darker eye, that would not be a scurfrium. It's only if that is showing darker than the rest of the eye. Well, there wasn't much normal on there because this is the inflammation. This is inflammation. In this, you see, this is an overall condition. The whole condition is bad. We're showing you some extreme cases here. And what do we have here? What number are we on? Basically speaking, according to Dr. Jensen's theory, and most people agree with him, we have basically a brown eye or a blue eye. And anything from that is a toxic condition there that discolors it. And many times we have had people, now I have to put brown on my driver's license or they'd probably throw me in jail for fraud or misrepresenting. Many people have put brown, but it's from the iron deposits from the water from the area that I grew up in, and I have a lot of deposits there, plus a few other things, you know, like some of the junk foods my wife fed me before she learned better, and some that my mother fed me before my wife got a chance to. I had to put that in. My mother isn't here, my wife is. But some of these problems, you see, are problems we brought on, and we see eye changes. We see color changes all the time. You see those eyes just coming back to a color, and it's really beautiful. And my wife had really discolored eyes, and they always called them hazel, or, you know, you have green eyes and things like that. And then they start coming back to a truer color, and we found some things there. All right, where's the nerve ring here? Can you see it? Yeah. All right. Now, you see how some of them you can see very, very easy and some you can't. All right. This, I believe, is the right eye. No, the 7. What does this tell you here? It's an inflammation, and it hasn't been as long as the chronic, but it is an inflamed nervous system. And you all also pick it up here. All right. We better do a little bit of looking into some eyes now. Would you rather go with this? What? All right. Let's show this one then. All right. All right. Let me see if it gives it to us. This is a brown eye. It doesn't give us what eye this is. It appears to be the right eye to me. But this is not straight, so I can't give you... You see how this eye is cocked off quite a little bit, so we can't be too accurate on just what area we're talking about here necessarily. But this is an inherent brown eye, and this is inherent blue. You see how there's much more fiber and detail in this part than there is in the brown part. The brown eye is much harder to read, and dark brown eyes are very difficult. I've had 2 people it was impossible to read the eyes. I could not put enough light in the eye. One of them was from South or Central America, and another one was an adopted relative of mine, and the eyes were just about coal black. I mean, I've never seen anything so dark, and you couldn't get enough light there. Notice the wreath here looks yellow. Do you see that? Rather than the white, now this looks yellow. Or the nerve rings, I'm sorry, the nerve rings. Do you notice here that you can follow the nerve wreath here? From the side it's hard to see here, but it looks like it, I can't see where it goes there. Right along here. And then you kind of lose it over here, you see? This is where it's very difficult to follow. From the side I can't follow it at all. It's very difficult to locate that. Now you find some of the brown eyes, you cannot find the wreath on it. You can't tell. So that in that instant, you cannot tell the amount of ballooning or so forth in the colon. Sometimes you will find where it will show in the transverse colon to some degree. There are some things showing here, but that is the reflection here from the eyelashes, and this is a reflection from there. Yes, yes. Now this, the lymphatic rosary is in quite close, and you notice this? You can see the scurf rim on this. Notice the dark scurf rim here, but you notice how it is lightening up here, so you can see through it far away. Some places it goes in much further than others, and it's also on this side, but it isn't as easy to follow. In the brown area, it's not as easy to follow. Notice the anemia. It's kind of a fuzzy line here. Not too sharp, kind of fuzzy. That doesn't mean in this particular case that the picture's out of focus. It just means that that line is not that definite. All right, we'd like to... all right, my wife will tell you what the cloves are all about.
Then we'll turn our chairs, and 2 people will face each other like they're going to do here, and then put your cloves in your mouth, and just let it stay in there, and your breath will smell nice. It won't offend anyone.
There. No, right there. All right, there's some people that use one of these that you can get for reading stamps and so forth. You just push the button and you've got a light in there. And this is fine. It's all right. It does the job. But I don't like to turn that around to find it and have to keep changing my magnifying glass. So I don't use this, but a lot of people do, and some like it better than the other. But this is just a 4-power magnifying glass, and most of them are just a 4-power glass, and you can use any type. But I like this because it's easy to hold. You can hold the chart if you have the eye chart. And I just use a pen light. Dr. Jensen uses a regular D-cell flashlight. Some of them use a C-cell. The only disadvantage I have with this is that you burn out batteries a lot faster. But I have electric one. I have one that has a rheostat or a transformer on it, and it just drops that voltage down, and then I just buy bulbs. But if you want to do it, I like to kind of take a look at the eye and see the scurf rim here and a few problems here. Just have them open the eye. You can hold the grid up here if you want and hold that in front. And if you just leave your finger and always make a contact here with the face so that you don't poke them in the eye, you can put the light right behind, and by shadowing this as you shade this around, you can see these spokes and these lines show up. It's interesting that sometimes you can be looking with the light over to this side and you can see some of the spokes on one side. You can't see a thing on the other side. It looks like a perfect eye. And you move that over on the other side and it's just like they're like this and then they just open up. They're just like this and open up. But the way to see this is that if you put the light right in here, you don't see very much. But if you move that light over to here, do you see how that shows the depth as you move that light around? If you have the light right here, it doesn't show it. You move it around here, you get the shading and shadowing. And that's the way these grooves are and these fibers are in the eye. And you'll see these troughs moving right out from the pupil right out to the outside of the eye. And I just hold the grid here, and as you look, you can line that up with the kidney area. You can just raise that upper eyelid and hold that up there, and you can see that he had some trouble as a child in the mastoid area and in the ear area. You can see over here that there's been some lung problems in the upper lung. That doesn't mean he's been on marijuana. It isn't a marijuana sign. You can have other marks in the lung. Just have to keep it clear. When I want to zero in on an area, I don't necessarily use the magnifying glass for everything. I sometimes want to find what area I want to look on. Then you can zero in with the magnifying glass. Also, you can place the magnifying glass right over the opening there and use the magnifying glass to see what you want to see there. And you can see here that there's been a neck injury, there's been a lower back injury, some pressure on the bladder there. You can see that there's been something wrong with the appendix. Now, before I ever start looking at anyone, I've already filled out a chart on them and asked them what operations they've had, and I've already marked it on my chart. If he's had the appendix removed, why, I just know that that takes care of that. If he hasn't, why, if he hasn't told me that, why, then I'll say, have you ever had any problem with the appendix? Oh, yeah, I had that out when I was such a... All right, so then we go on, see. Or maybe he didn't have it out. I say, did you have a little bit of trouble with it? Well, yeah, in school I used to have trouble, but I don't have it anymore. And it doesn't show necessarily active at a particular time. We can find a little bit of pancreas weakness here and a little bit of gallbladder problem. Now, you see the scurf rim shows up all this. You just go around. Now, some people like to start at one place and go around. I have a tendency now... Everyone has a different technique. I have a tendency to take a look and see what jumps out at me and kind of zero in on it. I sometimes start one place and sometimes another with a person, depending on what the problem is. Now, what we'd like to have you do, and some of the women may have dresses on and can't do it, but I straddle a chair like this to do it. Some people sit facing each other. I have done it for years with someone in a reclining chair, and I knelt to the side of the chair. You can end up with occupational disease. Dr. Jensen, for years, sat sideways. So he would sit at a table and sit sideways like this and read them and record them, and he ended up with a lower spinal problem that took a great deal to clear. So you can sit and look at each other like this, but one of the reasons that I do it this way is because, generally speaking, I will just ask them to fold their arms on the chair. This is a little bit high. They fold their arms on a chair, put their chin there, and then they're going to hold pretty still. Then they're going to hold pretty still for you, and it's a lot easier. But I like to always come toward the eye from the back, never straight into the eye. As soon as you come toward the eye like that with someone, they have an automatic reflex to pull away, and particularly if you're working with anything like a chart or anything. So I always come from behind. You come around and you put that light in there, and you're not putting it right directly into their eye, you're not blinding them so much, and you come in from the side, and you approach the eye always from the side, and you don't worry the person, because when something starts coming straight at you, you're going to duck, blink, or pull away from it. So this is just a few things. Now, as I mentioned, I mark the chart. I have a sheet that I just marked, and I mark it red or blue in the area. Now, there are others that want to write down, or they have a sheet that gives the list of the things that they mark off. And they just check off lungs, bronchioles, whatever you want. Now, since we don't have a lot of these charts to use, what we'd like to have you do is turn and face each other. You can use the chairs this way, or you can turn and face it the other way, but pair up there and look at each other's eyes and see if you can see some things that stand out there. look at your chart and see what you can find, and then I am going to put the chart on the screen and see if you can find the area. So my wife will be checking with you. Just take a piece of paper and write down what you find, and let's see if you can locate some of these things. Incidentally, in a few minutes, there's going to be a continuation of the logarithm work by, who was it? Jack Piper. Just a few minutes, in about 5 minutes. So any of you that would like to stay for that, you're welcome to stay. See what you can find on the victim. I mean the person you're looking at. Look in the right iris. Use your chart if you need to. Go around and move the light around so that you see the different shadings and watch those open up and close. Look for the irritations. Look for the congestion. See what that digestion's like. Look at that stomach area. See what that small intestine's doing and see if they're assimilating what they're putting into the body. See how congested the colon is and see whether they need a colonic. We'll set up a colonic machine just outside the door here. A little bit after you get to your room and see all the problems. But while you're doing it, look at your chart, because tomorrow we're going to have a little examination and see how many of you can outline, how many of you can locate the key areas on the chart. So study the chart. I have been asked what happens when a person dies. I have never read the eye of a dead person. I don't know. Sounds creepy to me. I've never read the eye of a dead person.
It's very important because if you have a way of telling you.
I don't know whether you could or not.
Tell by the pupil what the,
How do you tell by the pupil?
there's no restriction.
Oh, well, I have people that have no response to light. I've had a woman come in with the right eye, didn't have any response from birth. Never any response to the pupil. I know, but if she's laying on the ground and I open her, she was laying on the ground when she was out in front of my office when I came to work, open that right eye and take a look at that eye and no response. No, just in the one eye, but if I looked at that right eye and saw no response, somebody could have it in two eyes.
Asked for a little bit more drilling on the logarithms, came out and said they were dead tired and they couldn't absorb anymore, and it is a late hour. If you would rather do it like a half hour coming back early from lunch or something like that, I wouldn't be adverse to that. It's after 10 now, and I think it would be wise to retire because I've got about 2 more hours of study to do with the other fellows in the engineering physics and try to prepare something for tomorrow, which I know nothing about. So I don't know exactly what's going to happen. We could do it tomorrow if somebody wants to take charge of setting up the time and whatnot. That'd be all right with me.
So let's set up the time.
Shall we just say then 30 minutes before class starts tomorrow after the lunch period?
No. He will start at
Oh, we won't need it. We won't need it first thing in the morning. We're going to go into cell structure in the morning, and he'll be talking about the energy of the organs in the afternoon, the way it's set up now. So. That's okay. That'll work out fine. Before lunch? Well, let the people.
Please fast forward to the end of this side, then you'll be ready to turn over at the beginning of tape number 20-6 slant 27 -7 slant 1 -77, meaning June the 27th through July the 1st, 1977. Dr. Reams, I can't even pronounce the word, theory of ionization. Lynn Johnson on